Hey, my friend, would you like to learn how to use non-surgical options for dealing with back and neck pain? Right from diet to exercise to regenerative technologies like stem cells or exosomes or PRP, and possibly avoiding surgery and recovering naturally. Learn about all the options you have nowadays on this exciting interview on back and neck pain and including anti-aging with an expert doctor in this field. If you're enjoying the videos on this channel, please make sure to hit the subscribe button down below so you can get notified when we release new videos. Our goal on this channel is to help you look and feel younger and live your most adventurous life. So make sure to subscribe down below. If you're looking for thicker, fuller, and stronger hair, make sure to check out fullyvital.com. The team has put together a set of 100% natural products that target your hair follicles in 4 different ways to stimulate hair regrowth. So make sure to check out fullyvital.com for hair wellness. Hello and welcome to the Anti-Aging Hacks podcast. Today, my guest is Dr. Jeffrey Gross, who's a board-certified and fellowship-trained neurosurgeon. Dr. Gross is the owner of Spine and a regenerative medicine practice called ReCELLebrate and is seeing patients in Orange County, California, and in Henderson, Nevada, as well as remotely by computer video conference. In his practice, he offers specialized precision and concierge treatment options for patients with neck and/or back problems, as well as brain and head injuries. He provides a comprehensive approach to evaluating the pain generators of the spine and associated areas and digs deeper to find the source of the problem and identifying the root issues of persistent pain and injuries. Dr. Gross employs regenerative medicine and other non-surgical options first and foremost. He's an internationally recognized expert in these fields. With that said, Dr. Gross, welcome to the Anti-Aging Hacks podcast.
Thank you so much, Faraz. It's a pleasure to be here and speak with you and your audience, and hope we can expand on the knowledge and opportunities that people and patients have in the growing biotechnological explosion, particularly in regenerative medicine and newer and better options.
Yeah, I'm excited to talk to you about spine and also regenerative medicine in general outside of spine. So with that said, let's get into your background, Dr. Gross. Tell us how you got started in medicine and how you transitioned to what you're doing today.
Great question. Thank you so much for letting me tell my journey, my story. But I have an undergraduate degree in something that interests me deeply, and that's biochemistry. And when I got that degree, it was really mixed with molecular biology. So I had a deep love for what our cells are doing and how they're doing it down to the chemical level from college. So I have my degree from Berkeley, and I became rushed into a path down medical training. I went into medical school, did 7 years of residency and fellowship training in neurosurgery and spine surgery and spinal biomechanics. And I always had in the back of my head that great love for molecular biology that I really wasn't putting fully to work. So getting into practice and now over 20 some years in practice, I was treating patients with what I learned in the 90s. And although we get updated and we learn some new things, I wasn't tapping into that lost love for biochemistry. So I went back a few years ago and I read and I studied and I retrained. And now I'm happy to employ these cutting edge new regenerative techniques back to my own field in spine, and I'm learning stuff every day. I really enjoy the academic side, and I'm writing. I just got a textbook chapter out in regenerative medicine. I'm working on a book as well on anti-aging. So this is a ability to put some new passion into an old practice and employ the newest cutting edge technologies that hopefully some of my colleagues will start to adopt as well.
Yeah, fantastic. Thank you for doing that work. The world needs it for sure. So you're a neurosurgeon, but I also understand there are neurologists. What's the difference for the audience between these two professions?
A neurologist is a medical doctor who usually goes through a training path in internal medicine and then additional training in the neurology fields. Neurologists generally treat medical ailments of the nervous system like seizures, multiple sclerosis, dementia, Alzheimer's disease, demyelinating diseases other than MS, for example, post-viral syndromes, and that's very topical these days, right? Mm-hmm. In a post-pandemic world, and things like that. They generally don't do surgeries compared to a neurosurgeon who can diagnose and treat disorders of the nervous system that can, not always, and hopefully not, require surgery, like hemorrhages in the brain tumors, spine problems, disc problems in the spine, things like that. And also some movement disorders that can be treated surgically, some pain disorders, and peripheral nerve problems like decompressing a carpal tunnel at the wrist. So one is surgical and one is not. And although there may be some overlap in what they evaluate and treat, there's a large body of treatment that neurologists do for certain diseases like myasthenia gravis, for example, that certain neurosurgeons don't treat, and vice versa.
Okay, got it. Thank you. And we think about, at least the majority of people think about diseases and they think of the big four, right? Diabetes, heart disease, cancer, all of those. But when it comes to diseases of the nervous system, how common are these in the general population? Are we talking 1 to 2%, or is it 10, 20%?
Well, if we look at all populations across all ages, and we consider all the dementias, the Alzheimer's dementias, the other dementias, as the brain function declines, as it accumulates inflammatory changes, and I use that word really vaguely for now, maybe we'll get more into it. Mm-hmm. I'd say the incidence is probably even higher than 20% as you age. All of the other less common ailments have a much smaller incidence, probably less than 5% altogether. So really, we're dealing with the inflammatory accumulations of problems in the brain. Parkinson's, we're dealing with the accumulation of inflammation for Alzheimer's, and we're also dealing with such things in the spine that involve accumulated degeneration, which really is an accumulation of inflammatory change.
Mm-hmm. Okay, so let's segue into the spine, which I'm really excited to talk to you about because it's the first time we'll be discussing it on this podcast in any detail. And so back pain, as we were discussing before we started, is very common in midlife and beyond. And a lot of people struggle with it. So what are some of the common reasons that back pain happens for people?
Well, first and foremost, most people don't take really good care of their spines in a maintenance setting. Even people who exercise and go to the gym and have leg day and arm day very rarely have back day. And if they do, it's usually the upper back, right? It's rows and lats. It's very rarely the lower back muscles. So you may know, and I'll take a step back if you'll just let me run with it for us. The body has just over 200 bones, but we have over 600 muscles. And a good third of those muscles, many very small interconnective muscles, are in the spine. So the spine, or what we call the part of the body that goes up and down like the tree trunk, is called the axial skeleton because it's along our main axis up and down. And that we really don't give that enough maintenance, attention, and because we often sit most of the day, and we often have poor posturing as a result of everything we're doing in a curve forward posture position, on our cell phones or whatever we're doing. We are really stressing and debilitating and wearing out the supportive postural and structural muscles of the spine. Mm-hmm. So when we first, and a lot of doctors see patients like this, I have back pain. Oh, why don't you go do some core exercises? And people immediately go to the abs. And that's great. That's part of the core. Because you think about it, Faraz, we have our own built-in brace along our low back. And those muscles go all the way around our body. And that's a built-in brace. But that brace becomes useless if it's not structurally maintained. Mm-hmm. But it's not just the abs. If you only did ab exercises, you're actually probably doing detriment to the low back. We really have to build the back muscles. So the main groups of muscles that go up and down the spine on either side of the spine are next to the spine. So doctors call those the paraspinal muscles. And those muscles help keep our posture. They help keep our head upright. They help keep our low back in the proper curve and things like this. So we need to build those muscles and maintain them. That's first and foremost. Secondly, if one is overweight, that puts additional stress on the back in a biomechanically improper way. It stresses the discs in such a way that pushes the nucleus or the center of the disc and maybe we'll get into discs in a moment, but it pushes it backwards and causes it to, what the layperson says, is to slip. It puts forces to push out the nucleus out of the disc. So being overweight, not having a strong core, first and foremost, are the one way to really get to back pain at its core.
Fantastic. And we'll definitely dive into some of the muscle exercises that you can do, and possibly even weight issues and what that's causing. But as you said, let's dive into discs. Let's talk about discs, joints, vertebrae. What do these even mean before I ask you more questions?
That's great. So the spine is made up of really alternating blocks of bones called vertebrae, and they're very oddly shaped. And it's one of my love for going into the spine. That's why I did this. Is it's some of the most interesting anatomy in the body, and they stack up with cushioned discs in between each one of these. And in the neck, we have 7 bones called the 7 cervical vertebrae. Cervical being for neck. In the mid back, where the ribs are, or the thoracic cage, we have 12 because they match up with the 12 pair of ribs. And then in the lower back or lumbar spine, we have 5 vertebrae. And then below that, we have the sacrum, which is part of the pelvis. And in between all of the discs, except the very top one, because it's got some strange anatomy, we have these cushions. And the cushions have 2 parts. In the middle is really the biological squishy cushion, a biological ball bearing of sorts, and it's very moist in a healthy state, and moist things are squishy, and we want that squishiness. And if you think about your kitchen sponge, you just use it to wash some dishes. It's nice and wet, and you can squish it, and you just wring out the water. But if you've gone on vacation for a week and you come back, your sponge is dry and hard and needs to be moistened before you can use it again. Well, with age and accumulation of inflammation and degeneration and poor regeneration or healing of discs during maintenance of the spine, our discs dry out. We can see that on the MRI. They're called desiccated discs. And the dry discs don't cushion as well. And that's where we start to degenerate. And there's a whole cascade of changes that go with that. The second part of the disc is the tough, fibrous, rubber-like rings called the annulus. And they're named that way because they are rings, just like the Earth goes around the sun in one annual, these rings go around the disc in annular fibers. So not unlike if you've ever seen the inside of a golf ball, it's got all those rubber band type, construction to hold the ball compact, and our discs are made that way. And as we move around, bounce up and down, go side to side, there are forces pushing on that nucleus, that nuclear material, that squishy part, and it pushes up against the annular fibers, and the annular fibers keep it restrained. And that is a very, significant biomechanical mechanism. I like to call it kind of a biological ball bearing, as I mentioned, that allows us to function and deal with the physical stresses of daily life, walking, running, lifting within reason, bending, things like this. I mean, the spine is an amazing, mechanical structure because of that. But those discs are very susceptible, and that's where a lot of, not all spine problems, but a lot of spine problems begin.
Great, thank you for the explanation. Would you say that the majority of spinal problems are caused because the discs are either dry or some dysfunction of the discs over the bone? Because the vertebrae in the bone looks pretty strong. This bone, first of all. But would you say that the discs are where the problems mainly stem from?
I would say in the absence of a specific injury, a car wreck or lifting a 200-pound item at work or something like that. I think across the board, yes, I think discs are probably the most frequent cause of spinal problems. But I do want to give mention to our vertebra contact their neighbors, not only through the intervening disc or the intervertebral disc, but also 2 joints on either side in the back of the spine called the facet joints. And as the disc can degenerate, it puts more stress on the facet joints, and the facet joints can degenerate, and then they can negatively play off each other. So I would say this: the discs are probably number one, and the facet joints are probably number two. And you add them together, and you've probably dealt with 95% of degenerative spinal problems that lead to pain and dysfunction and disability.
Mm-hmm. Okay. You just talked about mechanical stress. So I want to ask a follow-on question to that. A lot of young men, and I would assume many women as well, do these exercises where they're lifting heavy loads above their head. And a shoulder press is one of the more common ones, but also just the shoulder, I guess the shoulder military press is one. But also if you're seated and you're using the machine, the weighted shoulder press can be one. And there's other exercises you can do where you're lifting weight above your head, even in the airplane when you're lifting your luggage over. Is that repetitive lifting? What I understand is when you're putting stress on your bone, it's actually making the bone stronger. But now there's discs in the middle that we have to work with. Would you recommend lifting heavy weights above your head?
Well, it depends on the status and health of your spine. If you're prepared for a certain load, a weight over your head or lifting, and you prepare the muscles along the spine and they're in good shape, you can handle an isolated load like that. It's usually the unprepared or the poor mechanics, like the airplane, throwing a heavy bag up into the bin, or something unexpected, when the body's not prepared. So although you're right that the most stressful things for the spine in the gym are compressive loads, and that means that we're shortening the spine. So any weight lifting up, or for example, if you stood and held dumbbells and we're doing biceps, your spine still has to hold that weight. Now, to avoid that, you can use a machine with one of the padded preacher pads in front of you, or a preacher bench. So there's no stress on the spine. You're just isolating the biceps. That's probably safer for the spine. But if your spine's in great shape and you're prepared for it and your whole body can handle it, then it's probably okay. We don't see a lot of low back injuries from people who are very muscular and in the gym. We see people go to the gym to try to deal with a low back injury because they have not been taking care of their spines the way we all should.
I got you. Okay. So if you're bracing, as you said, it's not bad. And this brings me back to some of the times when I'm doing, I believe the exercise is called farmer's walk, when you lift as heavy of a dumbbell in both arms, 80, 90, 100 pounds each, and you're walking as far as you can. And basically that's training your musculature to lift more weights and become more rigid. But like you said, it's causing a lot of stress on your spine because now you have 200 pounds more that you're carrying. But as you're saying, if you're doing it properly, then it should be okay. It's not a problem.
Well, I don't like to go to extremes. Some of the, I'm going to call them CrossFit type hormetic exercises, where you're really pushing muscles to the extreme. They can be beneficial for muscle gains, but we don't want to overstress a structure that's not prepared for it. So I think it's something to work up to.
Yeah.
And because you have to build, you could probably carry those dumbbells, but you have to have significant leg muscles and glute muscles, and your core has to be good to protect the spine while doing it. So you really have to build up to that. And that's an outlier. I mean, you have to really be in great shape to do something like that. So I don't want people to jump ahead to the highest weight to get the most benefit when their structure isn't ready for it.
Yeah, and young men do this a lot because they want to show off to their buddies, and it's all fun and games until you get injured. And then it's not fun. Okay, let's talk about inflammation. We know that inflammation is the cause of faster aging. Chronic inflammation is present in our bodies, whether we know it or not, whether we like it or not, especially in mid-age and beyond. And so anything we can do to reduce it, get it out of the body, and manage it is something that will help extend healthy years of our life. And so when we talk about spinal problems, disc degeneration, how does inflammation play a role, and what are the factors that cause the inflammation in the first place?
Great change here to talk about inflammation. Inflammation is sort of a broad term. And really, if I could take a step back and to lead into this, it's a cellular programming. When we're born and we're young and everything heals and we're in great, everything's great, we have very little inflammatory programming in our cells. What we do have is is healing programming. We do have health programming. We do have antioxidant and DNA repair programming. When that programming wears out or becomes, degenerated, if you will, the programming of the cells is more of a, well, we'll just let things happen. We'll just let some of these toxins come in. We'll just accumulate. We can handle this, and that's where we get a change in the programming. And programming means what genes are being active or expressed. Even though we still have those youthful, healthy genes, in fact, we even have genes in our DNA that are preserved from lizards who can regenerate their tail. They're just off.
Right.
And that off is programming. And we want to turn on those types of genes. Not that we could regenerate our tail yet, but we want to turn on those healthy, youthful genes. And that is synonymous, at least for this discussion and similar discussions, for anti-inflammatory programming. It's a cell programming or cell metabolism that's healing, regenerative, and youthful, versus an inflammatory one, which is less of or no in healing, regenerative, youthful. So inflammatory programming is really an aging programming. In fact, aging is the accumulation of this inflammation, or what you call chronic inflammation. And there's a term you may have heard called inflammaging, because really aging is accumulation of this. If you didn't accumulate these program changes and the inflammatory collections of wrong proteins and things, and the reaction to those proteins, the inflammatory reactions, we really wouldn't age. At least physiologically, the clock still ticks. You still turn 21 on your 21st birthday, but how physiologically old you are is different. And we see that separation in how old you are on a calendar versus how old you are biologically or physiologically, what we call lifespan versus health span, as you age. And you can see, for example, a 75-year-old man who's active and has muscles versus a frail one because of how they have accumulated inflammation or not. So as we now go back and apply that to the spine, and thank you for letting me kind of run away with this, the inflammatory chronic stress changes cause the disc to dry out. As our stem cells collect inflammation, they're less likely to regenerate the disc. And the protein, think about the disc for a minute. There are not a lot of cells in a disc. It's basically the gristle, okay? It's the cushion, not unlike the meniscus in a knee. It's kind of this biological rubber. Mm-hmm. And it gets its nutrients, its blood supply, its nerve supply, and its regenerative power from the surrounding vertebral bones in just what we call the end plates. And that's where we start to accumulate changes in the marrow. And in some cases, as we age, the marrow can be depleted, and you get a reduction in the structure of the bone called osteopenia or osteoporosis. Mm-hmm. And that's really when we're spiraling, because we're losing our marrow, and the marrow is the main source of our stem cells. So if you take care of your bones, including your vertebral bones in the spine, you're going to take care of your whole body. And you're going to be able to take care of the metabolic type of issues that you mentioned earlier that are inflammatory, obesity, we'll call it difficulty managing sugar, insulin resistance, or even as far as diabetes and the accumulated inflammatory heart problems that we have. If you take care of your bone marrow, you'll take care of your whole body. So when it gets to the spine, we got to take care of the bones. So that requires weight-bearing exercise. It requires hormone maintenance. If you're aging, you're losing your hormone levels, you need bioidentical replacement if it's safe for you. We need the right supplements and minerals. We need some sun exposure. We need anti-inflammatory mental peace and meditation and breathing, the importance of breathing, and restorative sleep. All these things help our cells go back to the youthful, healthy programming. The accumulated mental stress works against us.
Mm-hmm. Fantastic. And so I was just going to get into this of what might be a holistic approach that you employ for tackling some of these neck and back problems. Let's just focus on back for now. And you mentioned that there's two majority reasons why people have back problems. One is the disc, and the other, I forget the name of the joint that you mentioned, but also you just mentioned you have to take care of the bone marrow, you have to take care of the bones. So how might you And I know you started talking about this, but like, let's lay out some of the framework that you think about when you say, let's tackle any back problems as much as we can non-surgically.
Well, first and foremost, we have to know where the problem's coming from. So, and this is the field of what's called precision medicine. People come in with what they call back pain, and we have to narrow it down. Is it coming from a specific level, a specific disc, a specific joint, more than one? It's unlikely to be coming from all of them at the same time. So we usually do a full history. I ask people to stand up and show me exactly where take one finger and point to the source of the pain, or draw a picture with their finger on their lower back, because sometimes it's not exactly what we think. For example, people come in and say, I have low back pain. My doctor's been looking at my lumbar spine, which is the spine in the lower back. Turns out it's maybe not even from the spine. It's from a joint off to the side called the sacroiliac joint. So it requires a good history. If we listen to the patient, we're going to learn a lot. That requires time. In this era, in health insurance, forcing doctors to have 6 minutes with the patients, those doctors are not going to catch all this. Then it needs a good physical examination. We have to, see where the stress points are. We have to move the patient around, test everything, make sure there's no nerve problem down the leg, for example. And then usually imaging. Typically in this modern era, MRI is the most common. We can see a lot in MRI. We can see the disc quite well. You can't really see it well on a CAT scan or an X-ray. You can't see it, at all. So the MRI can help give us a status of a particular disc or joint or these things. And then we match that all up in a process, a doctor's pattern recognition process called clinical correlation. And from there, sometimes we have to test out where the pain's coming from with a numbing shot or a numbing block. And that's usually a Novocaine-like medication to numb a certain area. And if there's benefit, even temporary, then we can say, aha, that's the spot. That's like going to the fuse box at your house, flipping off a switch and yelling inside to your roommate, hey, where'd the lights go off? Oh, the bathroom. Okay, this switch goes to the bathroom. So it's that check process. Once we know, then we can have a precision plan to deal with that thing. So usually, like I said, it's a disc or joint problem in the back. And we start out with making sure that the patient has a good core all the way around, the right exercises are employed, that the patient's having an anti-inflammatory lifestyle. So this is back to the holistic question. I'm sorry I circle around a lot to get there to set the stage, and I appreciate your allowing me to do that. But probiotics are key. And listen, I didn't learn about probiotics in medical school, but I know about them now, and I take them twice a day myself. I have everyone working, because it's more than just digesting food. It's about the anti-inflammatory assistance that these particular bacteria give us, and they affect large parts of our metabolism in our body, including the bones. I want patients on any missing vitamins, particularly vitamin D. Vitamin D intake is associated with longevity. A lot of us are vitamin D deficient. Patients need a little bit of sunlight, of course, with the right sunscreens and things to protect their skin. We need to have other inflammatory activities, like I mentioned, proper sleep, proper breathing, full breaths. I mean, yoga is wonderful for that. There, you can just do breathing exercises. But all these little tips and tricks add up to an anti-inflammatory lifestyle. But probably most important, though, is diet, and that's what we consume and when we consume it. So we're talking about the macros. We're talking about adequate protein. We're talking about lowering our carb intake, which is hard. If you go to a grocery store, they sell you carbs. You have to go to the protein department to find the protein, right? Most of the shelves are lined with carbs.
Yeah.
So and then proper fruits and vegetables, polyphenols, getting our colors in our diet, and those work with the probiotics. So that's an anti-inflammatory lifestyle. I do believe in intermittent feeding. I try not to apply the word fasting to time-restricted feeding, but our body is not made to process calories all day long. And that is, if we do so, that's inflammatory. Eating and processing calories is an inflammatory process. So we need to give our body a break from that. Plants do this. Plants have a light cycle and a dark cycle. Photosynthesis in the day, They reset during the night. We need the same thing.
Mm-hmm. Fantastic. That's a lot of tips that people can employ right away. Now, I wanted to ask you, the discs, I would assume they're made of water and there's got to be some collagen in there as well. Is there, when we talk about feeding ourselves the right diet, if we do are hydrating ourselves well and eating a lot of collagen, will that eventually make its way to the disc?
In the setting of the right anti-inflammatory lifestyle and the right exercises and the right hormone balance, yes. Drinking lots of water all day long, it helps the body be hydrated, and the discs are more likely to receive that water if the body has water in it, more water. Same with collagen. You need the building blocks, but you need the hormones and the bone marrow to drive these nutrients into the disc, and you need the cellular programming to have the vertebral bone marrow at the end plates churn out new, we'll call them collagen-like proteins. There are other cartilage proteins in there, proteoglycans and others that involve collagen. But yes, those proteins are the squishy cartilage proteins that love water. But you need the whole mix.
Yeah, fantastic. Okay, and I want to get into regenerative technologies in just a second for cellular reprogramming. But before that, let's touch on a couple of things you mentioned. But one was supporting the spine through the muscles of the lower back and right along the length of the entire back, number one. And then two, how do we support the bone structure of the back as well? So what could you tell listeners about the muscles and the bones or the vertebrae in the back and how to support them?
So, first and foremost, we all do sitting, whether it's in the vehicle or at an office. We're both sitting right now, unless you could be standing. I don't know for us.
I'm sitting. I'm
sitting, and I sit in front of my patients until I get up to examine them or we're doing something. So I believe in good lumbar support. A lot of vehicles say they have lumbar support. You can push a little button down at the bottom of your seat, and it inflates a little, bladder of air in the back of the seat. That's minimal. So I recommend people go online and purchase, additional lumbar support. Now that's probably the best way to attack that poor posturing, because when you're stuck in a chair. But we should get up, we should move around, we should do the right exercises. There are, and avoid, bending forward too much with the lower back unless you're in great shape and doing adequate stretching and yoga. By the way, yoga and stretching give a little bit of hormetic stretch to where the tendons attach to the bones, and that activates some regenerative cellular programming. So that is an important tip. So yoga actually activates stem cells. Plus you get the breathing. That's why I enjoy the yoga classes personally. Fantastic.
Okay, so lumbar support, get them online, and do yoga and stretching. That'll also help activate some of the stem cells.
Right.
And I think we talked earlier on of men, at least, or I don't know if women do this, but ignoring the bottom spine and just focusing on the top of the muscles in the back, not ignoring the lower back muscles. Are there specific gym exercises that you found that may help with some of this? I know that maybe you've talked about like a Superman stretch in the gym that you could do.
Right. That's right. So I'll keep this relatively simple, and these don't have to be at the gym, but you can make them part of your gym routine. They should be part of your routine. But what's missing is the strengthening of the muscles in the back of the neck, the back of the back. The Superman, where you lay on your stomach and you lift your chest, your head, your arms, and your legs, so only your belly's touching the ground like a boat shape, and you hold it there. That's not just a stretch. You're strengthening those low back paraspinal muscles. If you want to really get fancy, you could, tighten your glutes and play with the legs. There are advanced ways to do that. But most people who start this exercise can only hold that a few seconds.
Right.
So the goal is just to hold it. Get up to 30 seconds and do 5 of those, and then that will build up those lower back muscles. Swimming is also good because there's no stress on the spine. You're horizontal with the earth, and you're working the muscles, particularly breaststroke where you have to come up. So those would be the types of exercises for the low back. They do make machines where you can add weight and go backwards where the resistance is felt. Those are great too. And then they make a bench where you start folded over, and some people will hold a weight if you work up to that, and you use your low back muscles as you bring it up. Those are wonderful. Those are building up the lower back muscles. The neck's almost easier. You could take a towel, roll it up, flip it behind your head, and just push back and hold that, and then push back. I do not recommend that people do the alternative where you work your neck forwards often, because we're using those muscles all day long. They don't need any love. We need to work on the antidote. It'll give us better overall posture. It'll build up those muscles that put the discs in the best biomechanical setting. It'll be less mechanically stressful on the discs if we maintain those muscles, improve them, and that maintains the proper curve of the neck, the mid back, and the low back.
Fantastic, Dr. Gross. Thank you. That's a lot of tips that people can employ right away to start improving the health of their spine. And if you've got issues, then of course you've got to come to a doctor that knows what they're doing, such as Dr. Gross. Now let's touch on the regenerative aspect of things, which I'm excited to ask you some of these questions. There's an exploding level of interest in a lot of regenerative technologies, non-surgical options for back and or other problems with the joint or the body. And a lot of physicians tout them as being anti-inflammatory. And so when we talk about some of these different regenerative technologies, there's PRP that's been around for a couple of decades. Stem cells have become popular, and also exosomes are exploding right now or in the last few years. And so what's your take on what are these technologies doing when it relates to inflammation of the spine, and what's your preference and what do you use?
Great. So regenerative techniques, the three you listed, PRP, standing for platelet-rich plasma, stem cells, and exosomes, and maybe we'll get into that in a moment, but all three basically have anti-inflammatory or youthful regenerative programming. They tell our cells to act more youthfully, to lay down the collagen, to regenerate. There's fantastic science behind this. There are wonderful studies, mostly out of Asia and Europe. We're a little held back here. Our hands are tied a bit. But there's great results. One of the most exciting things I follow is the French group under Dr. Herneglau. They have a study of knees that goes out over 15 years. And what they did, if I can describe this study for just a moment, I think everyone would benefit. They took patients who were recommended to have knee replacements. So they were probably had meniscus had worn down in the knee. They were probably bone on bone or close, and they had pain and dysfunction, where a surgeon in Europe said, you need a knee replacement. That's the only thing left to help your knee. And Dr. Herneglau's group created a study and said, hey, we're going to talk to those people before they have surgery. And they offered them, you can join our study, and we're going to do stem cell injections. So they were using stem cells. And half the patients got injected into the knee joint where the meniscus is. Remember, the meniscus is like the disc. Not a lot of cells, not a lot of biology going on. It's the rubber gasket of sorts. And half the patients got injected into the bone just above the meniscus and below the meniscus. So the very, down side of the femur and the very top of the tibia, if we can talk bone names, okay? And they looked at those patients over time, and they published them multiple times. And they just finished last year, I think it was the 15-year publication. So they've been doing this a long time. Turned out that the group that got injected into the bone did better than the group that got injected into the meniscus of the gasket. And think about it, makes sense. The biology is happening in the bone. That's where the nutrients come from. That's where the cellular activity, that's where the programming, the anti-inflammatory regenerative programming is happening. So they are jazzing up the marrow to work as it used to when we were young. And you think about when you're 3 years old, or if you have any nephews or children, or whatever, they skin their knee, and a few days later that scrape is gone. Like, how did that heal so fast? And then, I banged my elbow and I got a bruise for 2 weeks. So why do I want to heal like that little child? Right. Well, this is what we're doing. We're giving a little dose of youth through this regenerative process in a certain area. So they used stem cells. They showed that in the knee study that after 15 years, I think it was between 80 and 85% of patients still did not need a knee replacement. And remember, 15 years earlier, they did. They saved those patients, and they're still saving 80 to 85% of them.
That's fantastic.
You might ask, what happened to the 15 to 20%? Can they do it again? And I would say probably that, well, it wasn't part of the study that I'm aware of. And even the patients who had the injection in the meniscus, it was 60 to 65% of those patients, I believe, still didn't need a knee replacement. So that did very well. That was good enough as it was.
So this was just one injection? Or one set of injections?
I have to look back at the study. It might have been a series of injections, but they were all done, I think, within the year after recommending the knee replacement. They just followed them out. So it wasn't ongoing treatment. It was a time-defined treatment. So Dr. Hunegla has done this in the spine, has not published on it, and really that's what when I went back into regenerative medicine, paired it with my spine background, being fellowship trained. This is what we're doing, is we are delivering regenerative biologics to the bone just above and below a disc when that disc is proven to be a degenerated, inflamed pain generator in patients who are suffering. Now, someone published on this before me. There's a Dr. Patine from Colorado who did show after a year, now this is anecdotal, he didn't have a lot of clients, this was very new, that there was some increased water content or hydration of the disc, which makes it squishier, which we want, after 1 year. So he actually had an MRI before and MRI after, and he shows the increased water content that matches the clinical improvement, meaning the reduced pain. So that's our target. We're using the biologics. Now, I've used this word biologics because PRP is great. It's useful in tendon injuries, muscle injuries. They're doing it for joints. It does help. And that is a concentrated growth factor from your own blood. The stem cells give a bigger dose of healing and regenerative, but you got to harvest them out of your bone marrow. It's painful. It's, what have you. So exosomes came around, and exosomes are really what the stem cells give off, thousands of these small vesicles or bodies of growth factor information, and they send that programming information to the neighboring cells and your own stem cells and say, wake up, we're activating you, we're sending you programming information so you can heal like that 3-year-old scraped knee that goes away like this. That's that reprogramming, and it's temporary. We're not going to reprogram. This is not long-term reprogramming. We just need enough reprogramming to enhance the disc biology, and enhance the disc structure, reduce the pain. So these are done as injections into the bone under sedation at a surgery center under X-ray guidance. We got to do it right, the right place, safely, and we're now using the exosomes or the extracellular vesicles directly.
Yeah, fantastic. I'm a big fan of exosomes and their potential, as you described. Totally, the growth factors and the signals that stem cells give off are carried in the exosome. So now we have the technology to take these exosomes directly and inject them. And it's even better to hear that you're employing the sniper approach, where you're X-raying and targeting the joints or the discs that really need, instead of you spray and pray the entire back, which I guess would be very expensive for a lot of people because you just need so much material. And when you do this, Dr. Gross, how long? Again, going back to that study, we don't know how long 15 years is still going on. In your anecdotal practice or in your practice, how long are you seeing benefits from these exosome injections?
Well, we haven't been doing them long enough, only a couple of years now to measure people, but people tend to do well, and they haven't, we do follow them out and see how they're doing. No one has gone backwards. So I don't have an outside number, but we also teach these people how not to overstress the disc again. If it took them 50 years to degenerate a particular disc, and we can give that disc back another, 5, 10, 15 years. And gosh, if we had to do it again, I'm sure we'd offer it,
And like you said, if you pair that with the exercises we described and some of the other information you gave us before, and be more proactive about your back, it could help delay the regression again, right? Because aging is going to happen over time. We know that, at least for now, until we start reversing it. But you can pair a lot of these techniques together to slow down the degeneration again, so you have a longer life on this treatment. Okay, fantastic. Um, uh, and so with that, is it, you talked about the process, the intake process, how somebody comes in, you look at the problems, you diagnose exactly what's going on, and then you go through all the approaches, the non-surgical approaches, which involve stem cells, which involve anti-inflammatory foods, and all exercises. And so once people get this, is there any indication that even though you're injecting the joint, there's other benefits to the entire body, or is it more local to the joint itself, to the spine itself?
We've had anecdotally people say, "Oh wow, my shoulder feels better," or something. They had a little ache and pain in the shoulder because, of course, the exosomes are small. They can get out. They go everywhere else too.
Yeah.
So we do see that. I would say that most people that come to us, we're gonna treat their issues. So if you come, you have a back pain, you have a shoulder pain, we're gonna knock out everything, and hopefully in one setting. So usually we're addressing all those problems. But in terms of, we'll say, side benefits from exosomes, absolutely, it's going to help your metabolism. It's going to help your cellular programming and anti-inflammatory programming in other areas, even if they only get a small dose.
Okay. We are coming up on time, Dr. Gross, so I'll be quick, but I have a few more quick questions for you. How long does it take to heal after, let's say, people get injected with exosomes?
I hear this question a lot, and it depends on how bad that disc looks and feels beforehand. If you have just, a little bit of inflammatory change, a little bit of height loss of the disc, it's probably going to be, some people feel better from the anti-inflammatory effect right away. And then it may take 6 months or 12 months to see the change on MRI. But most people feel better within months. I would say if you have significant collapse, we're not looking to restore the whole disc. We're looking just to get some more hydration, some protein deposition, some collagen deposition, some reduced inflammation. So, that could maybe take longer because it has gone on too long.
Right.
So the more degeneration that is there, the more regeneration one needs. There? Because those are opposites, right? There's regeneration and degeneration. And we're busy degenerating, and we're got this great technology where we can work the other direction.
Yeah, it's fascinating. And I would assume that this would apply, at least in some ways, even if there's been mechanical trauma to the actual bone or the vertebrae. Of course, it's probably going to be harder, but what's your, at least anecdotal evidence, or what have you seen in practice with, if there's mechanical trauma to the bone versus the disc, what does that look like with exosomes?
You're absolutely right. Actually, the early use of stem cells was to help people who had bone fractures that wasn't healing. So that applies to the vertebra as well. But you said earlier in this podcast, weight-bearing exercise to the bones is actually good for the bones. And you're right. It's good for the bones. It stimulates the end plates and the growth plates, because that's where the most important stem cells are in the marrow. So really, weight-bearing exercise is hormetic for the bones. It stimulates or gives a little stress to the marrow to say, wake up. Well, we're enhancing that with the biologics. But we do see patients that have disc degeneration, the bone above and below, on the MRI, a particular sequence on the MRI called inversion recovery. We do see changes. And these changes were defined by a doctor out of the Cleveland Clinic called Michael Modick. These are Modick changes. And those Modick changes are structural traumas in the bone marrow. And we love to see those, because those are targets for me. I want to treat that area. That area is most affected. We do the same in the knee. I want to see where the tibial plateau marrow changes are. I want to see those changes. So there is trauma. We can address that trauma. It's the same regenerative activity to regenerate disc proteins than it is to improve that same marrow. They're one and the same, even though they're different tissues. They are cohabitating.
Yeah, it's fantastic that we can use one biologic to treat all of that and other rampant inflammation in our bodies. So that leads me to the other question. What other services do you have in your practice when it comes to anti-aging and or regenerative biologics?
Thank you. Well, I love to meet new people and do a full precision concierge visit with them, even through telehealth. We go through their lifestyle, their supplement game, their labs. I'm often can't do it all in one visit, and we send people for labs or MRIs. We talk about what's bothering them, what's slowing down metabolically, and we maybe change the supplements, or we add different probiotics or certain exercises, or we evaluate how to rehabilitate a certain area of the body. And there are also some anti-aging medications that are coming online. If you follow, people are using metformin, rapamycin. There are other mitochondrial health that I'm starting to learn more and more about now. Is we have cells within our cells called mitochondria, and they need love too. They have their own DNA and they have their own metabolism, and they're very important in the oxidation or antioxidation state of the cell. And then we talk about diet. Diet is probably number one. So somehow I've become a diet counselor or that. I think we talk about protein intake. Most Americans do not get enough protein. Too much protein can be a problem, of course, for the kidneys, but we have to find the right balance. Our macros just don't have enough protein, and we have to maintain muscle mass. So if you look at, the older population that declines rapidly, they have poor bone mass and poor muscle mass. They have low vitamin D levels. I mean, they don't take probiotics. So there are very simple things we can do to slow aging. So we start with that, and then we move towards spot treatment. Do you have a knee problem? Do you have anything else? Do you have, are we dealing with dementia? We have some older patients that come in, their memory's not the same. I have patients with kidney failure, metabolic problems, insulin resistance, and we look at all of it.
Fantastic, Dr. Gross. That seems like a bottom-up approach, and you're doing so many things in those evaluations, which I'm excited about. And of course, anti-aging and longevity. This decade is going to be fantastic. And it looks like you're also writing a book on anti-aging. Is that correct?
Right. I have a book about halfway done called Young Again. It's going to go over what we talked about, tips and tricks from the very simple, how to sleep longer, to the more complex supplements, vitamins, breathing, exercise, weight-bearing exercise, for example, great for the bones and the stem cells, foods that activate stem cells, all the way through regenerative medicine. It'll be a reference or a resource for people.
Fantastic. I can't wait to read it when it's out. Let me know, and you feel free to come back on the podcast. We'll promote it. Also, when people that are listening to this show, how can they contact you? How can they get a hold of you? Are there social media or website information that you want to give out?
Yeah, so I have I don't do a lot of social media, but we have a lot of fun with our Instagram. So I know a lot of people aren't on Instagram, but if you want to check out, we try to have funny and light podcast, not podcasts, but posts, and that's it's at ReCELLebrate. And you can go to Facebook. We have a ReCELLebrate page. You can check me out on LinkedIn and reach out to connect on ReCELLebrate. We do have a website, and it's ReCELL, because we're reinvigorating our cells. So ReCELLebrate, and our phone number is 1-844-4-ReCell.
Fantastic, Dr. Gross. Thank you so much for coming on the Anti-Aging Hacks Show.
Thank you so much for having me. It's been a pleasure. I hope we talk again.